So welcome, Gwyneth, to the SOOT podcast, episode number 4. Thanks ever so much for coming on. Do you want to introduce yourself and give an overview of your career history?
Yeah, sure. God, how long have we got? Yeah, so my name's Gwyneth Ataderie. So I currently am juggling a few different roles at the moment. So my main role is head occupational therapist in a mental health trust. So I'm the across our acute mental health service line. So within that role, I am essentially looking after the OT services that we have in our acute inpatient units, but then also our crisis home treatment teams. Outside of that, so I'm also doing a part-time fellowship. So it's a fellowship in population health. And that is with an organisation called the King's Fund. So I think it's been about 8 months. We're kind of nearing the end of the year, but the time has just kind of flown by with that one. And then I'm also doing a master's. So I'm doing a master's in advanced clinical practice, which is also kind of coming to an end. So I've been doing that part-time for the past 3 years. So yeah, just quite a lot on my plate. I mean, I think in terms of my career history, it's been quite varied. So previously to working in the trust that I'm in, I locumed for a little while, and that was with a local authority. So it was like a reablement service for people who just kind of like just come out of hospital and needed like quick rehab, equipment provision, packages of care, that sort of work. But prior to that, I had worked in a local authority within social services for about 3 years. So again, a very, very different world to mental health. Even within my trust, I've had quite a few different roles. So I kind of started my time in the trust in one of the crisis home treatment teams. And my role kind of developed, I got a promotion, was then kind of looking overseeing the 3 crisis teams. So essentially, what had happened is I'd come into the trust. They weren't too keen on having OTs in the crisis team. They really did want me to work generically. I kind of made the argument where, actually I've been hired as an OT and I would like to do OT work. They weren't too convinced how I would work in the service. So I was like, okay, so did a lot of work to generate my own referrals when I was there. Did different interventions. I would write case studies, kind of evaluate the work I was doing, just to kind of like demonstrate, this is the work I've done. This is how we can work in this team. And it's a really valuable resource. So now we have that service across our 3 crisis teams, which wasn't previously, which is fantastic. That it's kind of become a provision that continues to be resourced, and continues to be prioritized within the services, which is really lovely. I've also worked in CAMS within my trust. So I worked in a neurodevelopment team. So essentially diagnostic service for young people for ASD and ADHD. And again, it's quite a new provision for the team. Quite nice to join the team at that time to support the development of OT into the team as well. Which was great. I have quite a varied work history. I enjoy working in the community. I would say that is the area that I across my career I've enjoyed working in the most. I think there's just something about seeing people within their own environments that you don't always get in a hospital environment. You can't get in a hospital environment. Although I do believe that the hospital does have its place, and it is needed and it is necessary to kind of support people. But there's just a different sort of intervention that you can do as an OT in the community, which I love. So yeah, that's a quick kind of run through.
Yeah, it's a great breadth of experience. I love how assertive you've been as well in some of those roles, with really pushing the role of OT rather than being a generic practitioner, which in a lot of mental health teams, they do tend to be these generic roles, don't they?
Yeah.
In order to sort of assert that role, was it partly through your personality, or did you gather a lot of evidence to present to the wider team as well?
I think it was a mixture, because I think a large part of actually being able to convince people was also about the relationships that I built. So kind of going in, I made it a point to learn about what was happening already. How does the team function? What are the processes? What is the average length of stay of somebody within the team? What is the assessment process? What is the intervention process? What would somebody's journey look like in the team anyway? And I think it was really important for me to be able to know that, to be able to understand how I would insert OT and insert an OT intervention within the pathway that was already there. So a big part of it was producing the evidence and saying, okay, look, I've done this intervention. These were the outcomes. This is what we've achieved by doing a slightly different intervention or working in a slightly different way. But then I do think a lot of it was also building those relationships to kind of to get that buy-in, being able to build the relationships and explain what OT was, how OTs work. So I think it was mixed. I got on with a lot of the people in the team, and because I was able to build really good relationships with them, that made them more open and a bit more receptive to wanting to hear about OT, and wanting to learn and find out about how we worked and what the interventions would look like. So I would say it was a mix. It was a mix.
Yeah, because how would they know unless someone showed them or told them what you could provide?
Yeah.
Amazing. So at the moment, you're a population health fellow with the King's Fund.
Yeah.
How did that come about? How did you hear about the fellowship?
So it was actually my manager that had sent it to me. So I think it had been circulated in an email somehow, some way, and she had sent it through to know, this sounds like something that would be really fitting for you. Like, have a look into it. So at that point, I didn't know what population health was. I hadn't heard the term population health. But then when I kind of read into it and looked into it, I said, oh, this does very much sound like something that I would be interested in, and it's very aligned to kind of like my values and how I think about healthcare and how we're working with people, thinking about health inequalities, thinking about all of the other things that impact someone's health outcomes, whether it's housing, whether it's access to the community, all of those different things that are not necessarily thought about or considered by a lot of services. I was like, oh, this sounds right up my street. So I applied. So there were 3 different fellowships within London. So how the fellowship works is it's something that is commissioned by what was Health Education England, now NHSE. So they essentially kind of commission the fellowship across the UK. So there are fellowships. There are fellows up north, in the south of England, west, east, and then they had 3 within kind of like the London area. So I applied for 2 of those, and I was like, do you know what? I'll apply. I'm not sure I'll get on it, but it sounds like a really interesting opportunity. Applied. I got a call back for review for one of the posts. I was like, okay, okay. I've got this interview. I did a lot of preparation for it. And it was quite a long interview. It was about 2 hours.
Wow.
With 3 different tasks. Yeah, so it was
Wow.
quite full on. But I kind of came away from the interview with the mindset that, I prepared. I went in, I did my best, and actually, if I don't get it, it's gone to the best person. I wouldn't have felt hard done by, because I was like, actually, and I gave it my all, and I prepared as to the best of my capabilities. It was very much, I don't think there's anything else I could have done.
Mm.
I got a call saying that I'm successful. So yeah, that's how that kind of came about. So yeah, it was just something that my previous manager had sent me. She thought, this sounds like a really good opportunity. You should kind of look into it. So yeah. So
Congratulations.
very much, yeah, very much opportunities kind of being brought to me, which is, the manager I had previously, she was fantastic for that, and I would very much say that she was someone who would she was able to kind of like push me into opportunities and different things where I wouldn't ordinarily have pushed myself, or I wouldn't have identified that, that's an opportunity that I could do. So I feel like I've been very lucky.
She sounds like a
to kind of,
fantastic manager.
yeah, she is. I feel like I've been very lucky to have had that sort of leadership.
Yes. But it also
Yeah.
sounds like you put a lot of work into the application and the interview and did everything that you could. What sort of experience were they looking for from the applicants?
So I think it was really thinking about people who were engaged or curious about work regarding health inequalities. I think I used a lot of my experience, like thinking about like service development within my role as an OT and within healthcare. But I also drew on experiences and things I'd done in my personal life. So I used to run support groups for Black women who had experienced difficulties within their mental health. And this was very much something that I felt was important to do, just due to the stigma of mental health within the Black community. The reluctance sometimes to go and get support, the reluctance, whether it's reluctance to get support, start medication, go to, or just ask for help. It could be seen as very taboo, and just something that isn't, not widely accepted. I think things are better, but I think, I think we still have a long way to go, and I think it's not an issue that is just localized to the Black community in the UK. I think it is something that is prevalent in many different cultures and many different pockets within the UK, within the world, really. But yeah, it for me, it was an opportunity to kind of support people to think about mental health support, and what that, and think about it differently, and think about what are my needs as a Black woman, and what does help look like, and how do I get that help, how do I access the help.
And then is that the subject you then brought into the fellowship for your study?
No, so my study is a bit different.
Hmm.
I think I, I think for me, thinking about the fellowship, there are aspects around the workforce and how underutilized some parts of the workforce are within work regarding health inequalities.
Hmm.
So the focus of one of my studies in particular. So I'm involved in like lots of different pieces of work, being in the fellowship. But the one I'm kind of like working on is, I suppose, is looking at like allied health professionals and how engaged they are within work around health inequalities.
Hmm.
I think naturally, particularly as OTs, there is a lot that we do, and there are ways that we work that naturally consider how things are equitable, whether someone has the right support. It's a very holistic approach. Like how we provide care is very tailored and centered towards the person. So it is considering, cultural aspects, it is considering their environment, it is considering the resources that they have, because this is just how we assess people. And these are things that are important within that assessment process. Um, if I was to ask your average OT, do you think you're doing work to kind of address health inequalities? They would probably say no,
Mm.
because within the work that they're doing, they don't necessarily identify or are able to see that they're doing that work.
Hmm.
Um, and I think thinking about that workforce, if we're thinking about things more strategically to do with health inequalities programs and that sort of work, were often not considered,
Mm.
but it's because we're not supported to be engaged very early on in our careers, um, with those things. So the project I'm looking at is more thinking about the workforce and thinking about how we get everyone a bit more engaged and a bit more in tune as well, how we get AHPs kind of like in tune with that work.
And does this look like, is it a research project? Are you interviewing AHPs,
Yeah,
for instance? Yeah, and doing like a qualitative research
yeah,
project?
yeah, that's correct. So yeah, so it will be a series of interviews which will then kind of be evaluated, um to, yeah, just kind of see what comes out of it. And I don't necessarily have a theory of what might come out, but it's really meant to kind of like tease out, if people are doing the work, what's kind of supporting the work, what does work look like where they are,
Mm.
and if you don't feel that they're able to do the work, why not? What are the barriers? You know what could support you to do the work? Would you even know what that looks like? So yeah, I'm quite looking forward to kind of seeing what comes out of those interviews, and
Mm.
uh, what people's reflections are, within that space.
And through doing the fellowship, does that include support around research methods, things like this?
Yeah, it can do. I suppose in terms of the involvement within the projects,
Mm.
because obviously they are projects, that I might be kind of like sitting in and shadowing and looking at, where I'm doing my masters. The training that I've had about around research has been a bit more rigorous,
Mm.
a bit more thorough, and like, you know so the research methods are
You're learning that through the
a little
masters
bit
anyway, aren't
different.
you?
Yeah, a little bit different. So
Mm.
it's different ways of thinking about how to conduct research, really.
Mm. And you wrote a really nice blog post for the King's Fund, which is where I first heard your name. And you said in the blog post that most of the people on the fellowship were doctors, and I think there were only two allied health professionals. How is that being in a wider group of mostly medics?
Um, I think initially it was quite daunting.
Mm.
Um, I, I I felt a bit out of place initially. Um, you had doctors kind of like within similar levels of training, and I was there, this OT, this mental health trust. So I think just generally the way in which medics consider training, or it is something that is kind of like widely accepted within their professions. That continuous development, the engaging in fellowships. Whereas I think it is something that is not that it's not widely accepted in other career pathways. It's just not very well known about. If to some of my friends that are doctors, colleagues who are doctors, and I say, oh, I'm on a fellowship, they know immediately what I'm talking about, and they'll ask me, okay, where is it? Like, what are you doing? If I speak to, some of my other AHP friends or colleagues, a lot of them don't know what fellowships are. A lot of them don't necessarily understand what I'm doing, how I got onto it. So although a lot of these fellowships are open to everybody, it's who knows about them, who gets the opportunities, who thinks of them as viable opportunities to apply for. And I think, a large part of why my manager at the time had directed me to the fellowship is she had completed a Darcy Fellow a few years ago herself. And Darcy Fellows, typically they do go to doctors. Okay. So I think her having completed the fellowship previously, she knows that it's a viable thing for an OT to go on, which is why she kind of directed me to it, I guess.
And through what you've learned in the fellow, what you're learning in the fellowship, what do you think that might lead on to?
Oh, I think it's difficult to say. I think there's a lot of learning that you're able to take away and think about within your own service area. And I think particularly within my role as a head OT now, so I started that position in January, and it's a lot more operational, a lot more kind of like managerial, strategic, more strategic ways of thinking about kind of like service development and supporting people. So I think there are a lot of lessons that can be learned around how we're supporting our staff to like think about health inequalities work. So thinking our assessment processes, thinking about the interventions that we're doing, thinking about the information and the data that we're capturing. I think there are different things that we can kind of incorporate to ensure that we're providing a better service. And I think it's also advocating for things that maybe are a little bit out of our control and maybe are a bit higher up the ranks. It's being able to advocate for things that support the improvement of health inequalities within the work that we're doing across the board, across the service line. Whereas I feel in the role that I was in previously, where I was very clinical and didn't have any kind of like leadership or managerial responsibilities, you can only think in a localized way around what can I do as a clinician within my work, which is it's not limiting, but there's only so much that you can do as one clinician, seeing the X amount of people that you're seeing. I would try and advocate for other things to happen and other things to go through, but you are always limited by how much people value your opinions on things. And if you don't have a lot of influence for whatever reason, it's whether or not those things get listened to. So
yeah, so even OTs in the sort of more junior stages can be aware of and get involved in population health initiatives, but you feel like it's higher up, it's the managers and the leaders that have the influence to
yeah, but I think
changes.
it's dependent on the system that you're working in. So if you have leaders and you have managers who are open to your ideas and encourage ideas at every level to kind of push things forward, and I think as a manager, I'm always open to hearing what people want to do. How do you think we can make things better? What would make your working life, your working day, the work that you do, what would make it feel better?
Yeah.
But if you are working in a system where people don't really care about what you're saying,
you're not going to suggest anything, because what's the point?
Exactly. So well, you can suggest things, but no one's gonna take any of it on board. So that I think that is incredibly challenging. Thinking about the work. Yeah.
Okay. And you mentioned earlier a previous sort of project you'd been involved in about facilitating support groups for Black women living with mental health conditions. That was advocating for more positive experiences within the Afro-Caribbean community. Did you win an award for this?
No. So I won an award for another piece of work that I had completed within my trust. So for the work that I had done with the support groups, I actually got funding from the national lottery to support with the running of the group. The award I won, this was through, so within my trust we have an HP conference, and within that trust I won, and within that conference, I won our supporting diversity award, and this was mainly related to a piece of work that I had led on, which involved developing a BAME AHP mentoring scheme. So I'm a part of the AHP EDI steering group within my trust, and there had been a survey that was completed. I think the survey was completed kind of prior to me starting within the trust, and it looked at the experiences of BAME staff and as what they wanted to kind of support them in developing and progressing, and one of the things that was highlighted was mentoring, and I am a massive at mentoring, like having a mentor. I've had mentors. I mentor junior OTs, OT students. The majority of the people I do mentor are also Black. I think a lot of this stems from I suppose like coming into the OT profession as a Black woman, I found it incredibly difficult. The experience I had in university was very traumatizing. I was very, very traumatized by my university experience. That when I graduated, I was like, I'm done with OT. I'm not going to practice as an OT. I don't think I'm going to be a good OT. I was just happy to kind of like have my degree, and yeah, I did not practice as an OT for about 4 years after I left university.
Wow.
Because I was like convinced that I was not going to do OT.
Wow.
Just because of the experience that I'd had. So I did, lots of different jobs. At the time I was writing as well, and I was like, oh, maybe my writing career would take off, and so was doing lots of different things, lots of different jobs, and still kind of within the health and social care like field, but different jobs, not necessarily related to OT. And I think after a while, I was like, I don't feel that I'm working at my full capacity. I feel like I'm quite limited in a lot of the roles that I have, because I do have these OT skills and I'm not using them.
Yeah.
So then I was like, okay, I think I have to go and do OT. Did my HCPC registration and then started applying for jobs. And I think that experience it just stayed with me. And for a long time I didn't know any other Black OTs. I hadn't met, other than the few that I had trained with, I didn't meet any Black OTs in the workplaces. I didn't have any Black lecturers. And I think it was around in 2020 when there was the global movement around like Black Lives Matter, and there was just a lot of injustices happening. I was able to connect with so many I was like, I didn't realize there were so many of us. I didn't realize there was this many Black people within the profession, globally. And I got involved in a few mentoring schemes, and my whole reasoning is like, I had a very difficult time at the beginning of my career and entering the career, and I don't want other people who look like me be experiencing the same thing to feel that they don't have support. So I think for me it's really important that that they don't feel that the experience it will be challenging. It is challenging, but at least they have someone that they can kind of go to and say, okay, I'm experiencing this, and it will be an affirming, yes, what you're experiencing is racism, or this is how you can navigate this is what you can do, this, because I think there's also sometimes a lot of doubt, or maybe it's that I'm not a good OT, maybe it's that it's not racism, and it's that I'm not a good OT, which sometimes is not the case. It is people just being racist and you're a fantastic OT. But actually sometimes you just need to hear that. So for me, mentoring is super important in being able to affirm people's experiences as people of color kind of coming into the profession. And so for me, I was like, I think it will be something that's really important to develop within the trust. So it took about a year and a bit to get the pilot up and running, volunteers for mentors, because we did a pilot scheme, and then it was recently evaluated a few months ago, and just really good feedback around it. So that was really kind of like the basis of the award that I had won, because it was quite a big piece of work, but it was I'm glad that people kind of went into the process and felt that they got something significant from kind of like being involved in it. So I mean, I think mentoring is great. I'm a massive advocate for it. So
sounds like you absolutely deserve that award. I mean, what a brilliant scheme. I mean, you've likely prevented staff from leaving their professions because of it, and just really helped their well-being in general, I imagine.
I mean, one of the feedbacks was, I was ready to kind of leave the trust, and actually the support that I had from my mentor really encouraged me to stay. So
great feedback.
I mean, it's disappointing in the sense, because it's like, oh, what experience are you having? But then also the support is there, and there is always support. And I think it is one of the big things for me. There is always support. There is always a way to kind of like get that support, and sometimes it's mentoring.
And it takes somebody like you to coordinate that service. to link mentors
Yeah,
and
it's a lot. I mean, I
to
think
get the support?
so it was a challenge, but yeah, it was just really a great thing to kind of like get up and running and off the ground and get people involved in it. So
can you see
yeah.
yourself supporting other trusts around the country to start up similar mentoring schemes?
That's a good question. I mean, I would hope a lot of them have something. But yeah, I'd be happy to kind of like share
Because you must have learned
the work.
a lot by doing it.
Yeah, I'd be happy to kind of like share the work and share the experience and the processes. You know, there are lessons learned and things you do a little bit differently. Um, yeah, but yeah, I think it's if people can get involved in mentoring or get a mentor or mentor, and it's particularly the mentors that we need. Like, share your knowledge, share your experience, share. You know, I think people see being a mentor as something like that is very scary.
Mm-hmm.
And I have to know all of this and be able to guide this person and do that. And actually, it is sometimes it's just about sharing the experiences that you've had, and being an impartial way to kind of like listen and gently direct and even sometimes it's sharing your network. Who do you know that can support this person and maybe answer the questions that you're unable to. So I think it's the perception sometimes people have of mentoring that is might make them a bit reluctant to want to kind of like get involved and volunteer.
Yeah.
So, but it's great. It's a great thing to be involved in.
Yeah, absolutely brilliant. Well, we're going to get cut out soon with a 40-minute Zoom time limit.
Oh, okay.
So that's a good place to wrap it up. Anyway, so it's been amazing talking to you. Thank you so much.
Oh, thank you so much for the opportunity.
You're very welcome.
Yeah, I think sometimes you don't realize all the things you've done until someone sits you down and asks you about it.
It's really inspiring. It's really inspiring, all the work you've done. You should be proud of it.
Thank you so much. It's great catching up.
Yeah. All right. Thanks ever so much then. I'll be in touch.
No worries. Take care.